Now, moving on to ALK tyrosine kinase inhibitor treatment, and shown here is various organs that are affected by ALK tyrosine kinase inhibitors. Generally, these are very well tolerated, but these are some of the organ systems that can be monitored, that will need to be monitored when someone is on ALK-TKI therapy. Next slide, please. And there are 5 drugs, as Dr. Hirsch mentioned, for ALK fusion-positive non-small cell lung cancer. And like in EGFR TKIs, we have 3 generations of drugs. And one of the reasons why patients develop various side effects is because these drugs target different molecules beyond ALK, as seen in the table. And then the molecular targets of these drugs are non-overlapping between agents, meaning that each drug has unique side effect profile compared with others. Next slide, please. And so looking at, one of the most commonly used drugs is alectinib. Common side effects are anemia, usually mild. We can usually monitor or deal with those interruption and modification. And then edema can happen in all these ALK-TKIs, actually. Myalgia is one of the most common side effects of alectinib. And so CK, which is a muscle enzyme, creatine kinase muscle enzyme level, is something we monitor for our patients regularly. And the liver toxicity and nausea are the common side effects. And brigatinib, the common side effects are diarrhea and the muscle enzyme elevation, so it's creatine kinase elevation and nausea. And hypertension is a unique side effect of brigatinib, and we need to monitor blood pressure regularly on brigatinib. And then I will spend one slide for the early onset pulmonary events associated with brigatinib. This is a very unique side effect of brigatinib. In terms of lorlatinib, which is 3rd generation drug, common side effects are hypercholesterolemia, so how cholesterol is high, or triglyceride levels. Edema is quite common, 55%, an increase in weight, peripheral neuropathy, and importantly, mood and cognitive disorders can be seen in about 16 to 21% of patients. However, sounds a lot, but the rate of discontinuation is quite low with these drugs, and the far right column showing the discontinuation rate, which is 7 to 13% among these agents. Next slide, please. The early onset pulmonary events associated with brigatinib is something the field has been recognizing as we use the drug, and this isn't common, 3 to 6%, and patients feel shortness of breath, chest tightness, and sometimes you also have hypoxia, meaning low oxygen level. And Dr. Kamij and colleagues described rapid tolerization to early onset pulmonary events with the brigatinib is possible during continued dosing with frequent assessment in stable patients. For patients with severe symptoms, a really bad breathing problem and low oxygen, then those interruptions should be considered with the supportive care with supplemental oxygen. And the CT scan below is showing in the middle the ground glass opacity that happened with brigatinib, which subsequently resolved with the supportive therapy. Next slide, please. Lorlatinib has, as Dr. Hirsch mentioned, has the best hazard ratio for the extracranial and intracranial among all the ALK-TKI therapy drugs. However, it is associated with a unique side effect such as hypercholesterolemia, high cholesterol. So cholesterol is something we monitor very closely for these patients, and also triglyceride level. When the levels are high, we start with the statin. Usually we either rosuvastatin, pitavastatin, or pravastatin. These interact less with the lorlatinib compared with other statins. And when a statin is not enough, we utilize fibrates, fish oils, nicotinic acid for the hypertriglyceridemia, high level of triglyceride lipid. It is not necessary to interrupt the dose unless cholesterol levels or triglyceride levels are really, really high. Next slide, please. In terms of CNS side effects, again, it is important to counsel the patients, about the possibility of mood disorders, cognitive effects with lorlatinib, which sometimes can be significant, but the good thing is that it generally improves and resolved following those modifications, and those modification guideline is shown in the table on the slide. Next slide, please. In terms of edema, I mentioned that this happens with all the ALK-TKI therapy with the varying degrees of incidence and severity. The highest incidence with lorlatinib. We recommend using compression stockings and elevate the legs and then also diet, increase exercise to use the muscle to squeeze the water out the legs. And sometimes we need to utilize diuretics such as furosemide or Lasix.